I'm Moekti P Soejachmoen. I'm a lead advisor for market access at Katalis.
Hi, I'm Keiko Nowacka. I'm a gender development specialist at the Asian Development Bank.
Hello, I'm Paul Bartlett and I'm the director of Katalis.
Thanks Keiko for joining and also Paul for taking time for this one. It's a special occasion for us because today we gather here to talking about the topic that is attracting both global attention and also local action, which is care economy and its relation with trade. Could you share how the ADB is promoting gender equality across its activities and how do they contribute to ADB's mission?
Thank you very much for the question and thank you for the opportunity to speak here at Katalis. It's really a great honor to speak about such an emerging, complex, but really critical question about bringing together very important issues around gender equality, trade, as well as care, and all these are very much linked. But this is very much a new area. For ADB, gender equality is one of our operational priorities, and we're very proud of our track record on gender equality. Last year, 99% of our operations included gender targets, and this is an achievement that we've been able to do through our strong mandate and commitment to accelerating progress in gender equality through really dedicated actions and investments, as well as technical assistance and knowledge. So we do this through working with our clients, whether that's the public or the private sector, and identifying where are the gender gaps and how can we close them. We see this and we do this because there's a very clear business case for investing in gender equality. So we see this in terms of the returns on investment, to use that kind of language, but we also see the social returns. And this is where I think the nexus between care and trade come together. And that's why it's very exciting to be part of this discussion today, and I'm looking forward to it.
Thank you. So Paul, the first question, how does Katalis work to promote both economic and development outcomes?
Thanks, Uti. So Katalis, first and foremost, strives to get development and economic goals out of what we do. So we're essentially a program which supports the IA-CEPA, the Indonesia-Australia Comprehensive Economic Partnership Agreement. But we're conscious that we want to get development outcomes as well as economic and commercial outcomes. So we're always looking at ways in which we can get both of those things in everything that we do. One area which I think we can emphasize is our mainstreaming of gender equality and social inclusion. So in everything we do, and this is part of those development outcomes, we're really looking for benefits for women, for people with disability or otherwise socially excluded groups. And to give you a bit of color around that, one of the things that we worked on recently was supporting an Australian and Indonesian consortium in the healthcare sector, a group called Aspen Medical International, but they partnered with an Indonesian company. And their plan is really to invest in the Indonesian healthcare sector only in one province, originally in West Java. And they plan to build 23 hospitals and 650 clinics, believe it or not, just in one province. And of course, this is a big investment. This is a planned investment of over $1 billion over 10 years. But this, we thought, was a great fit for what Katalis does because it has great economic benefits, but it also has a great development outcome for women. In Indonesia, 70% of the healthcare workforce are women. But also, this is a healthcare service, and as it happens, most of the services provided in the initial hospitals will be for women and children. So we also see really good, strong local development outcomes for women and children, and obviously multiplier effects in the local economies where these hospitals will be built.
And why has now Katalis become more intentional about raising awareness about the potential for trade to grow for the care economy?
I think fundamentally, and let's not shy away from the fact that we are a business program, we're focused on business. We do see an opportunity. There's a great opportunity to actually build connections between Indonesia and Australia here. We want to take the opportunity through the Katalis name and the platform to really raise awareness about the care economy about the opportunities for business and about the development outcomes that we can get if we work in a holistic way with multiple stakeholders, including strategic partnerships with the ADB and other development partners.
Back to Keiko, the care economy is becoming a hot topic in development circles and gaining particular attention here in Indonesia. So how is the ADB engaging or plan to engage with the care economy in Indonesia and then in the Asia-Pacific region?
So I think that for the Asian Development Bank, we have seen the importance of the care economy emerge as a priority for our governments as well as the private sector, in particular after the pandemic. And even in countries such as Australia, where I am also from, this was really very much a hot topic. So the issues about care and who's doing the care and pay for care workers and the conditions of care workers is a global issue that has really come to the forefront of the agenda, and I think that's really welcome. So for ADB, we see this in Indonesia as well as all our developing member economies, where the labour force participation of women in Asia and the Pacific has been declining and is actually one of the largest gender gaps in labour force participation is here in Asia, despite pre-pandemic, very dynamic economic growth. So care is really an economic issue that needs to be taken into account. This is one of the reasons that ADB is working in this space. So we do this through really kind of three ways. So we are increasing kind of our investments into the care economy. We have been doing quite a lot of work on long-term care, elderly care, in Indonesia as well as other developing economies across Asia and the Pacific. And now we're also increasing our focus on childcare. And this is very much a social norm area that is at the heart of our current strategy 2030, where we are trying to be in line with SDG 5, which really put a very strong focus on that unequal share of unpaid care work between women and men, as well as the household and the rest of the community. So we do this also by supporting governments in developing guidelines, policies, so a lot of policy dialogue and technical support. We do this also through thinking about the entry points for providing care services for, let's say, women entrepreneurs to be able to work through constructing a business development centre where they can access skills training to develop their business. But we all know that there isn't much care infrastructure in our economies, so providing some childcare support so that women can leave their children in safety, in quality childcare, whilst having that opportunity to access other type of skills building. So thinking about where are the entry points.
So how do you see ADB and also Katalis trade policy and promotion activities contributing to increasing the accessibility, affordability and quality of care services in Indonesia? And what are some promising examples for that?
Thanks, Uti. So some promising examples first. So I mentioned earlier the Aspen Medical International example. We've also worked with a company based out of Sydney called Simpler Health, which is now committed to investing in the special economic zone in medical tourism in Bali. And likewise, we worked on a collaboration between the two nursing communities in both countries, the professional associations in Indonesia and Australia, to really build the foundation for what we hope will be a mutual recognition arrangement on nursing, professional nursing in the future. In terms of more explicitly on the care economy, we hope to do, and particularly for childcare, we hope to run our first Raising Awareness webinar in mid-July. This will be the third of three, and in July we hope to bring together practitioners from the public sector and the private sector and the business communities in both countries, and try to identify real tangible opportunities which bring those development and those economic benefits to both countries. Through this facilitated exchange among business leaders in the child sector in both Indonesia and Australia, we hope to identify concrete business opportunities to support in the childcare sector, such as franchise models, curriculum and standards development, furniture, equipment and health and safety supplies, training and capacity building, or educational materials and technology.
Thanks for that question, and I think it's really thought-provoking actually, because for a long time the care economy has been seen very much from a gender lens and not so much with a trade lens. And so this conversation today, and I think the conversations that are happening in Indonesia are really very much at the forefront of a lot of the global discussions. And even the question of gender and trade is relatively new. The WTO has a gender and trade declaration from 2017. So these are relatively new topics that, again, a lot of countries are trying to think through. So let's say, what can ADB with Katalis and other development partners do in terms of the work that we do in supporting our countries? So I can see a few. One of them is making sure that we understand care as a sector, and that means breaking it down into the building blocks. So what do we expect for quality childcare? We need care workers to be properly skilled, to think about qualifications. And across Asia and the Pacific, most care work is done by informal care workers. So that's kind of a starting point, I think, for any kind of discussion across all of our countries. So how do we do that better? So, and it's completely right that we focus on the link between care and women's labour force participation, but we shouldn't forget that, let's say in the childcare sector, it really is about children's development, and more research will really, bring to light the importance of early childhood education and care. And so this is also very fundamental when we think about quality. So then, because people are always caring, someone is already doing that care work. Unpaid, usually mothers, maybe grandmothers, it's happening within the home. So then how do we think about affordability to make it easier for households to make that decision? And so that goes about trade policy, but it's broader macroeconomic policy. So again, thinking about care as a sector that isn't just a gender issue, but it really is a macroeconomic issue. So what are the kind of investments that need to be done? What are the policies and regulations to make households and parents, and many of us are parents, want to put our children into childcare? So that's where kind of the accessibility and the affordability and quality is so fundamental. So making sure that it's intersectoral.
Is a multi-stakeholder approach to developing the care economy needed in Indonesia? And what does it mean for the ADB and also Katalis, which are looking at the care economy through the trade lens?
There already is a multi-sectoral approach to the care economy in Indonesia. They launched their care kind of roadmap at the end of March, and that really brings together Bappenas, it brings the Ministry of Women and Child Protection, and there are many other government agencies involved in that. And I think that's very welcome, because again, care is not just a gender issue. This is a very promising start. And I think also, again, to repeat, and I think we can't emphasize enough, there is a link with women's labour force participation, because the time that women spend caring, whether that's for their parents or for their children or for other members of their household, is time that they are not spending able to pursue studies or to pursue paid, decent work opportunities in the labour market. So this is really thinking always holistically, and that's basically ADB's approach in Indonesia. I came to the some of the care work that we're doing in Indonesia through an entrepreneurship lens, because this was the obstacle that women entrepreneurs most often mention. They can't export the same way as men. They cannot travel to markets the same way as men. And this social norm barrier was preventing them from growing their business. So thinking about what access do they have to childcare? So in terms of multi-sectoral approaches, there's a lot of work that needs to be done, not just in Indonesia. Again, I don't know many countries that have this right. So some OECD economies have the capacity for entrepreneurs, for example, to feed into social protection programs. And this is still nascent in a lot of developing economies, but it means that women entrepreneurs don't, even if there was public infrastructure for, let's say, childcare, they don't have access to it, because they are by and large in the informal economy, not part of the formal economy. And then when we think about trade lens, it could be from different angles too. I mentioned women entrepreneurs, they can't export because they just cannot, they don't have the time to access markets, and they don't have the time to do that physical distance to travel. So that's one part of it, but there's also thinking about when we're doing trade agreements, where are the entry points to be more transformative, to be more progressive in thinking about, okay, maybe we need to think about other ways that we can support the care economy as a sector. So I think once we start to have policymakers see it as a sector, we're going to see a lot more momentum.
I think it's probably fair to say in the IA-CEPA, you know, there are multiple entry points and opportunities that were missed to look at, you know, to look at how to develop the care economy and broader trade and services more generally. And I think there's an opportunity now to reflect on where those opportunities are and to broaden the discussion to those other stakeholders and those other sectoral groups.
Okay, Paul and Keiko, this is the last question. What message do you have for public and private sector actors engaged in trade? And what do you see as the top priorities for Indonesia to use trade as a lever to accelerate growth in care services?
So I have a list of priorities, but I think the message from us would be to think about this holistically. So the care economy and trade agreements and trade policy, efforts to strengthen the care economy and efforts to do trade investment can be mutually reinforcing. I think that's the key message of this discussion. We certainly see efforts to support the care economy as being beneficial to women's economic participation and for women-led businesses to women-led businesses to also benefit from that. But the corollary of that from an international trade and investment perspective is that it drives, we can see there's a real driver for increased levels of trade and investment between the two countries.
I would just reiterate that message for Indonesia, that care is a sector that requires investments and thinking about the different areas where that can happen. And that can be for women entrepreneurs are more likely to work in the care sector. So how can we support them to expand their business, and what can trade policy do to support that growth? So again, thinking about the potential entry points. When we think about other kind of sectors that sometimes are seen as male-dominated, we talk about special economic zones, they're not always male-dominated. There are women, there are accompanying households. So again, that gender lens or the gender analysis, getting the data right to understand how do you make those type of investments more gender responsive. And the third part is really think about regulations and learning from others about the building blocks to building quality, affordable and accessible care sector. So there's, I'm really going to take away from this discussion this whole kind of how trade can, the trade and knowledge kind of bilateral exchange can happen. And I think there's really a lot, and a lot of us are working together. There's a really positive momentum since the pandemic to think about these issues. So I think it's a really great time for Indonesia to have that leadership, to pioneer, to experiment and to learn from others in this space. And hopefully we'll meet again in maybe 5 years' time in 2030, and we'll be able to see the fruits of those investments.
Okay, thank you Paul and Keiko for the very fruitful discussion. Thank you, and please enjoy the coffee that we already prepared for you. Thank you everyone. Please.
Thank you.